with just the pupil holes, and then when I come out, it's gonna have extra holes in them. I'm actually not that nervous anymore. I'm okay.
That's good.
Yeah.
Did the water help?
The water helped.
From Focus Clinic.
Cold
The
water
first thing
helps.
you do is come and drink the water. Calm your nerves.
That's good. And look. So this is the good thing about having dark irises.
That's enough time.
Right, how long do you think it's going to take?
Before we get seen.
No, the actual procedure. The procedure.
Per eye, maybe about 10 minutes per eye.
No, it's less than that. 10 minutes, the whole surgery. I think it'll be like seconds. It's going to be zip, zip, done. And I'm going to be like, oh, is it done? Yeah, have you started? So it's finished.
Do you think so?
Yeah. I think it's going to be incredibly quick. Come on, Sara's whole surgery was 10 minutes per eye. Yes, thank you. Okay. Go around and have a look at what my autos come up as. It's going to be nice and high class and high sales. Should I put my chair up or is the table going to come?
Where's the table be? Okay,
Oh,
confirm.
glasses off.
Yes, please.
Okay.
Okay, how's the height for you?
It's a little bit high. That's better. Okay. Thank you.
Okay, just focus on the hot air balloon. Okay, we're gonna move to your left eye. And you can rest back.
All it is a stretch for everyone like this.
Okay, you can move to the next one here. Okay, it's going to be a light puff of air on your eye. Okay, look straight ahead. Just one more time. Okay, same for your left eye. Look straight ahead. And just one last time. Okay, and you can rest back.
I don't feel like that. Are we doing the end one?
No. Just give me a sec. Okay, just gonna repeat this one just one more time, okay?
Yeah.
Forward. Okay, again, look straight ahead. One more time.
Can't do it.
No worries, just a couple of blinks. Okay, look straight ahead. Perfect. Same for your left eye. Okay, take a couple of blinks. Okay, look straight ahead. And just one last time. Okay, you can rest back.
I've never been able to take my pressures properly. I've never been able to take pressures properly. I'm the worst person to take pressures. Do you think it's going to be like that when he comes through with the laser? And I'm like,
Yeah, I think so.
no, but I think he's going to take my eyelids. I think he'll take my eyelids.
I don't know what he's
He
going
might.
to
He'll
do.
have to do a speculum to hold it open because I can't do it. I'm like, I was trying.
It was really
hard.
funny to see you.
I was trying hard. I was genuinely trying my hardest to like. And I couldn't do it. It's chronic dry eye. It's been having dry eyes since abusing contact lenses for like.
Plus
20 years.
parking 20 minutes away and making us walk through the dust.
No, there was no dust. It's London, okay? It's fine. It's part of. Okay, if I look at you naturally, do my eyelids open past where the iridotomy is going to be?
Yeah.
They do, right? So then technically, if you zoom in enough, you'll see it.
Maybe. Well, I
Okay.
can use myself right now.
So this is the before. Yeah, and then we'll do the after. Are you happy with all these glasses today?
Yeah, not the Gucci ones.
And not my rimless ones.
No.
I need to get them out before surgery day, just once. The vintage.
How old is it?
These are from 2000 and I want to say 2009. And then the rimless ones are 2000 and I want to say 2004, 2002, 2002. Because I got them from Optical Express, and they were really skinny. And it's when everyone was wearing really skinny glasses, and then they've got the green and red stripe down the side.
That already sounds awful.
No, it's so nice. And then my lenses come out really thin because I put them through the lab myself with ultra thin. Even though the rimless had to have extra thickness, I said no extra thickness. Go with thin. I'll get them out on surgery day. I was going to keep them. They're amazing. Right, so I just had I had a drop in each eye of 2% pilocarpine, and it is to make my pupils smaller, so there's more surface area when the laser makes the hole in the iris. So I've just got them put in, and they stung for like a half a second. I don't think this actual drop sting, I think it's just having a drop in. But now she's going to put another drop in each eye in 5 minutes to make my pupils even smaller. So it's good you're driving.
Yeah.
So.
Okay, that's sitting down. That's it.
Is it this?
Huh?
Iridotomy. Do you know what that's for?
Pressure to stay low.
Impressive. Well done.
Yay! Pass my MCQ.
I'm able to more drops.
Okay.
We have to make the pupil really small.
Okay,
It's not about small. We want to make the tissue, the iris tissue, under tension.
okay. I'm trying to be a good patient.
You are a good patient.
No,
Why not?
you couldn't even get pressures on me. I was like blinking.
Oh, really?
She's a nervous wreck today.
Yeah. So pressure is good. 12.9, 12.7. Right. So we're going to just have a look. Glasses off. See, you didn't mistake that.
See, that's
Patient
crazy.
do.
I'm telling you, I'm not a good patient.
Very good. Okay. Right. So I'm gonna have a look at your eyes now. There we go. That's good. So the pupil is still reacting.
Okay.
Look down. Okay. So one good thing that your anterior chamber reasonably deep.
Okay.
That will help the ICL obviously.
Yep.
Most people with a long side prescription hyperopia, they have a shallow
Small,
anterior
yeah,
chamber.
small
Usually
anterior.
have a nice space.
Okay.
That's really reassuring. Okay. So I'm gonna put more drops
Yep.
to make the pupil small. It's still react. I don't want to react. I want to be tight small.
Okay.
Even if you have sometimes we do up to 4 times
Yeah,
drops,
that's
but you
fine.
have to do it because then make it much easier.
Okay.
You have a dark pigmented iris,
Yep.
so meaning that we need more energy to make the laser uptake.
Okay.
So you know the principle is just to make a tiny
Yeah.
hole basically
I
for
have
the
a really
fluids.
weird question.
Yeah.
So the iris is behind the cornea. So
Yes.
when you go into the laser, you're going to the laser through the cornea.
Through the cornea, yes.
And it doesn't impact the cornea.
No,
Nothing
no,
happens to
no,
the cornea.
because the laser travels through cornea,
Okay.
but they meet at the level of the iris,
So it's
and that's
what.
what.
Like this.
So the target behind the iris. Yes.
Okay.
That's how we do laser for the retina, for example.
Yeah.
Retina for the back, the three capsule when you do the
Okay.
laser capsulotomy.
Yep.
The same story.
So nothing happens to the cornea.
No, cornea is happy.
Yeah.
And you have a deep AC. Sometimes when people do the peripheral iridotomy,
Yeah.
the eye, and if the iris is so much behind the cornea,
Yeah.
yes, some laser, the old laser especially,
Okay.
when you can't do defocus, this you can hit the cornea.
Okay.
But with the new lasers, that's really difficult to
You
do.
will, yeah, you will. Okay.
Yeah, yeah.
Okay, that's fine.
Okay, so more drops.
Yep.
Look up. again. Close your eyes for me. Does it sting at all?
It's just wet.
Wait,
Doesn't sting at all, it's just wet. Yeah.
one moment.
Even now it's stinging.
Yeah, that's fine. So with pilocarpine, you might feel a bit of headache.
Okay.
Yeah, because it's pulled the muscles, the eyes, so it
Okay.
can cause headaches. That's expected sometimes.
So you need to put up with me today. Can
Yeah,
you?
yeah. So
Okay,
when
now
we
it's
do the
stinging.
when we do the lasers,
Yep.
what are the so the aim, you know, to make it that small, tiny,
Yep.
like a particle, the fluids,
Mhm.
so they don't block. Because the ICL for the hyperopia,
Yep.
it does not have that central hole, so they need to rely on this peripheral hole.
Okay.
And but this is what they used to do in the States till last year or till this year actually,
Okay.
because the launch with the hole was not approved, FDA approved until this year.
Recently,
So
yeah.
they always done this for anyone coming for
Yeah, so
ICL.
Sara's
Yeah.
was a hole, isn't it? So
Yeah,
she didn't need it. Yeah.
Exactly. So complications very rare to be honest, but
Okay.
it's still around because the laser hitting a tissue, and the iris is very vascularized.
Okay.
So if we hit a blood vessel, it might bleed.
Okay.
Usually the bleeding, not a big deal, it's got tiny oozing. I just press a little bit, cause some pressure in the eyes, then stop.
Okay.
Rarely it bleed a lot, but I can't see what I'm doing,
Okay.
then I stop.
Okay.
Second thing is that we can't achieve it because as it too much pigments, you increase the energy, but still you can't physically create a hole.
Okay.
Not end of the world, because we can do the same on the table.
Okay.
As I said last time, the many surgeons actually do the peripheral iridotomy, the
Yeah.
PI, on the table
Okay.
during the operation basically.
Yeah.
So I prefer to do it laser beforehand, it's more neat,
Yeah.
more controlled and nicely done. But if we can't or it's not big enough, then
Yeah.
I can finish it in theatre.
On the Friday.
On the Friday.
Okay.
Yeah.
That's
But
fine.
this is just to make sure so you know. Good?
And are you happy with my lens implants then? The ones that came and
Yes.
powers, you're all happy with that?
That's all
Okay.
good.
So
That's
the
all good.
access we've worked out.
Yeah, we
Mm.
checked everything exactly what we want.
Okay. Perfect.
Good. So what I want you to wait a little bit,
Yeah.
give the drops to work. We put one. I might put one just before the treatment and
Okay.
go to the laser room. All right.
Is it going to be the same room that we did?
Same room we done.
Yeah.
Yeah.
Okay. That's
Good.
Okay.
15 minutes. I'll put it back again. All right.
Okay, thank
Okay.
you. I just put the second set of drops in because the people are still reacting and he wants it to be really small. These ones did sting, so he might do another set in about 15 minutes and then it will hopefully lock my pupil really small and then we'll go through.
Nervous?
You know what, to be honest with you, I'm actually a lot more calmer now because he's very calming.
Yeah.
He just
is.
makes me sit like he's chill, so that is like chill.
It's okay.
Yeah. So we just got the paperwork and we've been given drops. So if you look, we've been given one drop to be instilled twice a day for 3 days. And then one drop to be instilled 4 times a day for 7 days. And that's Laxadex. And then we've got the consent form for the procedure today. And these are the drops.
And this is when the flash doesn't work.
So they're small.
Tiny.
And the other one? Both small.
Very small.
Equally small?
Equally small. One eyelash.
Okay, my eyeballs actually hurt. They ache. And I have a headache. They hurt. They hurt. and I have a headache.
Put light on your eyes.
No, you're okay. No light needed. The drugs have worked.
Do you think you'll put some in before?
I have no idea. I just want to keep them closed. And I don't want to open them. He's gonna have to use a speculum to open my eyeballs and my eyelids. Gosh, they really ache.
The muscles are being pulled.
Yeah, like I feel like.
I feel sorry for you. I know what that feels
Huh?
like.
How do you know what it feels like? When have you had pilocarb?
I get nausea headaches.
Okay, let's put some drops in your eyes. Yeah? Miss Plano. What's your prescription?
What do you mean, Miss Plano?
You're Plano, aren't you?
-1, -07.
Are you? Okay, so she's got glasses. I've never seen her with glasses on. I've never seen you with your glasses on.
I only wear them at home when I'm watching TV.
Okay, you drive me around a lot and I've never seen you wear glasses.
No, but that's because I'm doing
Okay,
local
here's her
work.
justification to it.
I'm only doing local
Because
work.
she's local to Harley Street.
And it's daytime, it's not night. I've got
Okay, we'll see how dark it is on the way home. And then we'll see if she even has her glasses with her.
They're in the car.
Prescription sunglasses don't count for nighttime driving.
No, normal anti-glare, single vision distance.
I've never
Yeah.
seen these
No
glasses.
tints.
I'll donate you my frames.
Oh my god. Just, do you know what? If I could fit into your frame, they'd be amazing.
No. You should have
Zenith would actually like your frame.
you should have the skinny red Gucci ones, the rimless skinny ones.
No. Those ones, do you see that ball over there? I'm gonna donate into it.
Like I'm not nervous anymore. I'm just achy. I'm over the nerves now. I'm done.
You want to
Glasses off this time,
Yeah. Please.
See, I'm more with it now. I'm more relaxed. I was nervous before, but I'm so ready for it now.
So normally professionals are the most less relaxed people.
Yeah.
Good. That's good. That's good. I think we're good now. Alright, so people nicely constricted. That's good. Fantastic. Press back.
I think they're relaxing drops as well.
The right one, yeah. Okay. There we go. Close your eyes. Good. Yeah.
Are you going to use a speculum to hold my eyes open?
No.
You're not. I think you should.
I'm gonna explain to you how it's gonna happen.
I really think you should.
It's
I'm not very good.
No. Right. So, the way you read the consent form,
Yeah.
are we happy with everything? Any question about it? Good.
My eyes hurt too much. I can't open them. I
Yeah.
can hear
Okay,
you.
that's fine. Yeah. So what I'm gonna do basically one. I'll wait for you to repeat it.
Okay, yeah.
So one, I'm gonna put numbing drops, right?
Okay.
Then we're gonna go to the laser room.
Yeah.
You don't need a speculum because I have a special lens
Yeah.
called the Iridotomy lens.
Okay.
And this lens sit on the eye,
Yeah.
special contact lens, sit on the eye.
Yeah.
One, keep the eye fixed.
Okay.
Two, magnify everything.
Okay.
And it's got mirror for me to see the angles what's on and the peripheral of the iris,
Okay.
so I can laser it
So
nicely.
it will hold my eyelid open.
Hold the eye
Okay.
open, yes, yeah.
Because you
Yeah.
can't guarantee that I will do that
No,
for you.
no. I want you to be relaxed, try to avoid
Okay.
squeezing
Yeah,
your
no, I
eyes,
won't
okay?
squeeze, I'm quite
yeah,
good.
Yeah, should be
Okay.
fine. Good. Good. So, numbing drops, then we walk into the laser room.
Should I tell you what your patients probably never tell you?
Yeah, tell
I'm
me.
going to miss my glasses.
Are you?
Yeah. I'm
What?
actually going to miss them.
We can give you like a frame, nice one.
Yeah, no, I'm going to keep all my frames. I'm going to miss my glasses.
Yeah.
Okay, that really hurt.
I mean, to be honest, this is for convenient, so you don't have to
Yeah.
live
It's because I don't
rely
want
on your glasses
I
all
don't
the
want
time.
astigmatism varifocals.
Mm.
I can't get multifocal contact lenses. My astigmatism is too high. But I don't hate glasses. I
Yeah.
actually like
Yeah,
glasses.
yeah. It's a convenience, isn't it?
Yeah.
Yeah.
I've just had enough of my astigmatism. I've had enough of my cells. I've lived with them long enough. They need to go.
It's the time to do it. Yeah.
Yeah.
Yeah. Good. Feel okay?
Yep.
Good. Okay, so let's walk back
Okay.
together. Step there. So your eye is numb now, right?
Okay.
And the lens we have here is called Iridotomy lens, right?
Isn't that gyroscopy?
Yeah, it's like disposable, single use for
Okay.
you, and then we throw it away.
Okay.
And just the nice lens sit in the eye.
Yeah.
It's got this like a prism in it.
Yeah.
Give me the view of the angle. Yeah.
Okay, let's do this.
Let's do this.
I'm quite excited now.
Yeah.
I was there
So
with
let me
now
tell
I'm
you,
excited. Okay.
in terms of sensation,
Yep.
some people don't feel anything at all.
Yep.
But some people do feel like stings or something in the eye, like a coloring agent, like a pusher.
Yep.
Okay. And throughout, you only look at this red light.
Okay.
You don't do much basically.
Yep.
Right. So to protect your eyes, you need these glasses, or you can wait. It's only about you.
No. I can wait. I'm looking at that one then. Okay, I'm looking at it. Oh my goodness, I can see my retina already.
Already?
Yep.
Wow. Okay. Fantastic. So I'm gonna stick the lens on the eye first. If you look up for me, facing that way. A little bit here. So now you look at the light for me. Lovely. Let's see. That's what you're doing. Like this. So sometimes you feel something, sometimes you don't feel anything. Let's try. Did you feel that? What sort of sensation was it?
Elastic band.
Elastic band, that's the noise. No.
No, like an elastic band. No feeling.
No feeling. We have a nice opening here. And another one here. Perfect. Good. So this down, no bleeding, nothing, pigment shedding around, that's normal because we disturb it. Look up. Good. Look down. There you go. Press back. Well done.
Was I good?
You've done it. You're so good.
I was well behaved.
Okay.
You know what it was?
Close your
It
eyes.
was because whatever gel you had was so soothing.
Yeah. Okay.
It was just so, it was actually really calming.
Okay, you done very well. I'm glad
Yeah.
we did 2 successful.
Okay.
I do 1,
Yeah.
but sometimes I do 2. 2 is good, so at least you know if one is blocked or not big enough, the second will work.
So we got 2 iridotomies.
2 electrodes, yes.
There we go. The big
2
spoiled
in
now.
one.
Okay.
Great.
There were some times where I literally couldn't even see that light, but it just went so fuzzy.
Fuzzy, yes.
I was like, I'm
Yeah.
still staring in the right direction. I'm not moving.
Good. So,
Right, ready?
I'm ready if you're ready.
Yeah.
Okay, if you look up from it started, well done you. Good. And we're going to look at the red light again. I'm going to get you in position. Yes.
The red lights are really blurred.
Yeah,
Look at that.
it's big like that. Yeah, it's because you're doing the bright light. Good. So we're gonna ask you to look a little bit up me. Let's choose. We call the crypt. So we choose the area which actually in the periphery, the thinnest tissue possible. Sometimes you can't find it. Let's try this one. Right, with the tape?
Yeah.
just now. It's not done for some reason. But we've done one already. I'm just waiting for the laser to run, okay? So we've done one already whole, finished. And it's a big size actually, it's big size. Let's see if I can do a second one. Self-test, okay. Lights back. And anterior focus. Leave it here, just keep it forward as you are. That is noisy. Okay. That's good. So it's done now. Just funny oozing, so I'm just gonna hold a little bit, then I release you. Well done. That's it. Press back. Each I have 2 holes. You feel okay? Good. So you're brave, I have to say. Yeah. Because you're really good still. And you see this is simple, right?
Yep.
Yeah.
I felt the second one more because I think I knew what I was expecting.
Yeah, yeah.
And it literally is like an elastic band. That
Interesting, they always call it second eye syndrome. You know that? Second, they said always the second eye can have a different sensation,
Yeah.
can feel more. I think it's just your adrenaline level
Yeah.
very different.
I think also what happened is when I was doing the second eye, because this side's a little bit blurry, I couldn't see the target as much, and I was like, I'm going to know everything.
Yeah, no, you do that.
Yeah.
Good. So we're going to have the next, they check your eye pressure.
Yeah.
We'll give you 15-20 minutes to settle.
Yeah.
Check the eye pressure, which is no spike, because the
Okay.
inflammation, all these pigments, they will be released, will go
Yeah.
to the angle,
Yeah.
and they can cause pressure. So
Okay.
let's check it before you go.
Yeah.
You have 2 types of drops.
Yeah.
One is for 3 days from now. I prefer you start both now,
Okay.
and one for the whole week. One is anti-inflammatory to clear all that debris, but
Yeah.
you're coming on Friday, right?
Next Friday.
Next Friday, yeah.
Yeah,
So you have
yeah.
this for a week at least,
Yeah.
yeah? And then you got the pressure drops just for 3 days.
Okay.
That's what keep pressure nice and that.
Yeah.
And that's both eyes.
Okay.
But I said I prefer you use both before you leave the clinic, so
Okay.
you feel like all control.
Yeah.
Well, good.
Okay. Yeah.
Fantastic.
So when she looks at the eye,
Yes.
with this fit lamp, she will see
So you're gonna
pigments
see
in the
a lot
anterior.
of pigments here,
Yeah.
and you're gonna see the 2 holes with the
I
fluffy
like-
edges.
At like 1 o'clock and 11 o'clock?
Yes, close, and here
Okay.
it's more separated.
Okay.
And fluffy, you might see some clotting, bloods around.
Yeah.
It's fine,
Okay.
it's oozing. But that's
So
it.
will it almost look like uveitis?
So that hole now is like look like funny edges, fluffy edges.
Yeah.
But then it's just become nice and round.
When
with
the
time.
pupil goes back?
With the- yeah.
Okay. Right, cool.
It's
Right.
like iritis, yes. I
Yes.
want to say, yeah.
It will
But
look
that will clear quickly.
that was good.
Yes.
Alright, so back to the waiting area?
Back to
Yeah, so the second eye definitely hurt. The first one didn't because I think I knew what I was gonna get with the second eye. It was like an elastic band going tick, 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 on your eye. And all I was doing was I was pushing my chin really hard so I didn't move. I was pushing my forehead really hard so I didn't move. And I kept looking at that light. I literally didn't look anywhere else. I was just looking at the light. But when I was doing the second eye, I felt like my first eye was blurry, so I couldn't even see the light. Sometimes it became double, sometimes it became triple, and I was like, just look towards where the light is meant to be. But sometimes you couldn't see the light. Sometimes you see the laser, so you can see all this red stuff going on here. And you're like, where is the light gone? But it was like a statue. Did not move. But no, pain-wise, it was okay. But yeah, I felt the second eye.
Do you feel the pain now?
No, nothing now.
Nothing
I just
now.
feel really like I'm in a fog. Like I feel like it's like I'm driving at night time when the fog's really dense and you're like, oh, I can see.
Do you think that
but
will clear up overnight?
that's the pigment flare that you were saying.
How long is that going to last for?
I don't know, I'll have to do slit lamp tomorrow and find out. But it's like I'm driving in a fog. This one is worse. But I've got my glasses on. Hold on. No, fog's still there. It's like I'm driving in fog. I put my beams on. That's what it feels like. Yeah, you're foggy. Like I can't even read iPhone. It's foggy. There we go. See what happens in 15 minutes.
Good for you. Forward. How is the height for you?
Height's fine. Thank you.
Okay. Look straight ahead. Perfect. Just one more time. Okay, same for your left eye. Straight ahead. Okay, and just one last time. And you can rest.
That was worse than laser. I'm sorry, proper bit is worse than laser.
Well done. Just continue waiting back in the waiting chair.
Right, so I've just put my drops in to keep the pressure low, and that's twice a day for 3 days. I'm just waiting 5 minutes, and then we're going to put Maxidrex in, which is 4 times a day for 7 days. So you just saw my eyes. What do they look like inside?
Literally, there was just pigment everywhere, like all over.
Anterior chamber.
Anterior chamber, and
he did say there's a little bit of blood cells. He said.
Yeah,
just from
but there was a little bit of flare as well. Like you can see extra little bits like going around. But then
so
he
this
did
will
say
be 50% less tomorrow. Okay.
And then hopefully by day 3 and 4, he said that it should all clear up.
So we'll see at the end of the week what it's like.
And your pressures need to be normal, he said.
Yes. So nothing above 24.
Yeah, nothing above 24.
And so what now at the moment?
They're 15, 16 at the moment.
And what were they in the morning?
They were 13, 14, I think, in the morning.
They've gone up by
if
like
I'm
one.
not wrong.
Yeah.
12, 13 maybe.
Okay, so gone up by a little bit.
Yeah.
Okay. So pressure lowering drops again. Max and export. 3 times. Okay, so it's now at 5 o'clock.
Yeah.
My eyeballs ache. They're achy. That's the only way I can describe them. Feels like they've been to war.
You just need to sleep it off. You're gonna be okay tomorrow.
Yeah. I'll be okay now.
Get you onto the chair.
Okay, let's go. Can you see them? Shall I drop my lid?
Don't touch it.
Can you see them?
Okay, now I can, yeah.
You can see them too?
I can see it. No, you just look straight ahead. There it is.
2. There's 2 there. Can you see the second one?
I can see the first one really clearly.
Okay, this side. Can you see it on my natural, looking straight?
No.
Okay, and then if I lift my lid.
If you lift it, then I can see it there. But I can see 2 on that one now.
Can you see 2 now?
Yeah, I can see 2 on that one nice and clearly. Wow.
Obviously I'm not
But
getting...
you can't tell like when you're looking at you.
Yeah, so now you're looking at me like this, straight ahead.
Yeah.
Can't see them.
No.
So we've already put one of these in, and there's one more before bed, and now we're putting the other one in before we leave. The amount of tissues I've used today. So now one of these before we leave. Yeah, got my tissue. That one stings. That one stings worse than the other one. That was so nice. There you go. I can't even open my eyes now. I did not know that's meant to sting. Right, so we're done for today. Next time we'll be at Focus, will be for the follow-up aftercare. Yeah, after surgery. Surgery's not here, surgery's in the other location. Bright lights and then feel. How do I have prescription sunglasses? say it's not too bad? It's fuzzy. Like I would not drive. It's fuzzy. Alright, so we're doing selfridges? Yeah? Why not? You've got parking now. It's like, you know, you're not here, you don't have to move your car. Okay, it's red light, but I think we can go. So do I. Maybe we should wait until it's like 8:30. The cold air is really nice. It's almost like it's cooling down my eyeballs. Like my eyeballs are on fire and now it's cooling down. You know what I've noticed about this area of London? They always have rubbish in the streets. Always rubbish in the streets.
But why?
I don't know. It's like they always think that's a really big or something. Always piles outside. And it's always like in the morning and in the afternoon. It's not that it's only in the mornings and the rubbish is going to go and get collected by a certain time. There's always, any time of day you come, there's always bags outside. I don't know. Let's see when we get there. So I still feel achy, but the cold air is nice. And my vision isn't as bad now. Coming out, it's not so bad. Okay, left eye's blurry. Right eye isn't. Alright, should we go further? Should we go to Pret here? Go further? Let's go further. Just gonna walk up. So tomorrow when we are at work, we'll have a look at the information, see what the eyes are like. He did let my friend have a look just now in the slit lamp, so she knows what it looks like now, and then she'll know that it's less tomorrow, up to 50% less tomorrow, and then cleared within 3 days. So she'll be keeping an eye for the next few days, and then surgery next Friday. But yeah, that's everything for today, and we will see how it goes, and surgery day next. So happy with that. Not too bad. It's almost like a prep. So now I'm prepped for surgery day in terms of holding the eyes open, in drops, and being compliant, and nerves. So I was nervous when I walked in, and now I'm really calm. I'm like, yeah, let's do it. Quite confident, and he's very calming. That's the other thing. So he's so relaxed and so chilled that you just get the vibe of it's right. He's confident enough to make you be contagiously confident in the room and during the procedure, and it was fine. So happy days.
What do you mean?